In the last 24 hours, we have identified 1,246 new cases and completed about 11,100 tests. Our positivity rate was about 11.5%. There are currently 1,100 people in hospital with COVID-19, including 263 in the ICU. I am sad to report that 18 more deaths have been reported to Alberta Health in the last 24 hours. My condolences go out to the loved ones of these individuals and to anyone who's lost a family member or friend in this difficult time. Of all those who have died from COVID-19 in the last 120 days, about 3 in 4 of them were not fully vaccinated against COVID. Almost 4 out of 5 of all those in hospital for COVID-19 and 91% of those in ICU in the last 120 days were also not fully vaccinated. These numbers speak for themselves. Vaccines are critically important. I've heard some concerns from healthcare workers and others who have received vaccine mandates from their employers. I would like to encourage every Albertan, regardless of where they work, to step up and receive the protection that vaccine offers. This protects not only themselves, but also those they come into contact with in their workplaces, in their homes, and when they socialize. We work closely with the National Advisory Committee on Immunization and our own Alberta Advisory Committee as well to look very closely at the evidence around what kind of immune response happens after infection, how that compares with vaccine. And to date, both our Alberta Advisory Committee and the National Advisory Committee on Immunization recommend vaccine after having recovered from infection as the most highly protective option that people have. We continue to look at emerging evidence, and as the Premier mentioned, we are looking closely at what other countries have done. But currently, I believe it's important, again, to remember, as the Premier mentioned, it's not either or, and that even if someone has recovered from infection, that adding a vaccine to that does provide enhanced and broadened protection, particularly against variants of concern. About 10 days ago, we did add some additional requirements to the regular operations of schools in terms of safety measures such as mandatory universal masking, in terms of required cohorting in elementary schools, and we are working with the Education Ministry to determine if anything additional is needed. But as was mentioned, education is a key determinant of health, and the access to in-school opportunities for learning and development is something that is a high priority, not just for those individuals attending school, but for all of us collectively. The number one thing that we can all do to protect schools is to reduce our in-person contacts outside our household, and for all those eligible to come forward and be vaccinated, as we are seeing that 5 to 11 case rate being driven primarily outside the 2 largest centres where vaccination rates are high. Looking very closely at the data, looking at the options and considering what might need to be a next step if over the course of this week we don't see the impact from the measures that were implemented on the 20th that we need to see. I would just emphasize that what all of us can do is minimize the number of contacts we have with others outside our household, and those who are eligible to step up for first and second doses of vaccine. And those are the things that will make it the most likely that our current restrictions will be sufficient to bend the curve.